novelty of the study. It was the first study to compare the different electrical charges that was produced through the fluoride iontophoresis, which will affect the tooth enamel repair, and it uses the real human teeth with early decay, white spot lesion, not artificially created, and it combines the advanced imaging techniques I talked about previously to study tooth remineralization and the crystal changes. Also, the study stimulates the natural tooth pressure, that is 15 mm of Hg, making results more clinically relevant. And it shows that the CIP, when compared to the AIP, is the most potent way and works better. It had 85% enamel remineralization. So coming to the aims and objectives, the aim is to find out how this fluoride iontophoresis with different charges affect the healing of the early white spot lesion. Objectives, there are multiple objectives. First of all, it is how the cathodal and the anodal remineralization through the iontophoresis technique change the enamel structure and the levels. Well, second one, to study if the treatments can change the crystal structure of enamel. Thirdly, to check how well fluoride moves in through these two procedures, cathodal and anodal iontophoresis, how it moves in and how it mobilizes and remineralizes. Also, it uses the modern imaging techniques and tools, and to understand how natural fluid pressure changes inside the teeth and affects this remineralization technology. So coming to the materials and methodology, they used 29 human premolar tooth because they will be extracted after orthodontic treatment with white spot lesions, divided into 3 groups that were treated with 5% sodium fluoride using cathodal iontophoresis, anodal iontophoresis also, and the traditional method of topical application of fluoride without electricity. They compared the remineralization techniques and they stimulated the pulpal pressure also of 15 mmHg, and they analyzed the mineral changes through the advanced micro CT techniques, SEM with IDAX and X-ray absorptive spectroscopy. Coming to the statistical analysis, in the study, they used the paired t-test for comparing the mineral density before and after treatment in the CIP and the AIP group and the topical group and the control. The paired t-test told about that the CIP group had significant increase in the mineral density after treatment of the iontophoresis. Control group showed no change. The second statistical analysis was Wilcoxon signed rank t-test. It was used to compare the mineral density before and after, specifically in the AIP group, and the outcome of it was the AIP showed small but significant change, that was around 2% in the group. Also, they did the two-way repeated measures ANOVA. In this, the mineral density in the intact enamel and the other control group in the same teeth before and after was tested, and the outcome was that AIP group showed a significant increase in both enamel and the lesions of the mineral densities, specifically in the white spot lesions. And lastly, they did the correlation analysis to check the changes at the surface level, that is use of the surface elements, what will be present, example fluoride, calcium, phosphorus, and they compared the mineral density. So in the CIP group, what they saw was high fluoride and calcium linked together with metal remineralization techniques, and in the AIP group, phosphorus and fluoride was linked with giving the higher mineral density. So the various minerals also affected the mineral density, and the correlation analysis was different in all together. So coming to the results, so we are comparing the 3 techniques, CIP, AIP and the topical application of fluoride with the control. So the results showed that the CIP technique with fluoride worked best to increase the mineral density in the remineralization of the early carious lesions, and it improved the crystal structure in early tooth decay, while anodal iontophoresis was helping but significantly only, and topical fluoride application did not change any mineralization technique. So if we compare it in the percentage form, AIP remineralized the early carious lesion by 85%, CIP only 2%, and topical fluoride 0%. So coming to the strength, it used the natural white spot lesions from real human teeth, no artificially created or the 3D models, compared the three treatment groups clearly, stimulated the natural tooth pressure while applying the CIP, AIP and the topical fluoride, and also used the advanced techniques of imaging and showed that CIP is the most significant in providing the remineralization of the carious lesion, and clearly explained the differences between the electric current flow rates between these three comparison parameters. Coming to the limitations. The limitations, it is an in vitro study, so it can be done in animal models. It is only done on the tooth. We can replicate in animal models and then we can do a clinical trial. Also only 5% fluoride application for the iontophoresis was used, so we can increase the concentration of fluoride, decrease it and see the effect of various concentrations also. And also it can be done if they use only premolar, so we can use different types of tooth for the same study in the for future applications. So coming to the study guidelines, the study aligns with the standard preclinical dental material guidelines following these parameters. If we compare it to the in vitro consort guidelines and ARRIVE guidelines, if it is done in animal study, these all guidelines were followed. The guidelines which were not followed were consort 7A, that is the sample size calculation. They had not done the power analysis. How the blinding of the samples of the 29 teeth was done, that was not mentioned. And reproducibility and replicates, no statement on the replicates or the repeats. Whether this experiment was done on triplicates or only once, it was not told. So coming to the future directions, we can test in real patients after doing an in vivo study, doing a clinical trial, study the long-term effects of fluoride iontophoresis in general, try different fluoride concentrations and durations over time, explore the effect of different types of teeth, not only premolar, check how often the treatment should be repeated, whether replications could be done, combine iontophoresis with other demineralization techniques, and develop a portable iontophoresis device for clinics for the